What if someone cut open your veins and let all your blood out? Would you survive such a procedure? If it were done today, you'd be dead within seconds. But during the Middle Ages, this was a common practice to cure all sorts of diseases. Let's find out more about this terrifying method. History is full of kings and empires. But hidden beneath the surface lie forgotten rituals, bizarre beliefs, and chilling truths. Welcome to the dark side of history. Hi everyone, welcome back. Today we'll learn about one of the most frightening methods used by medieval healers. Bloodletting, also known as blood opening, is a form of therapy that involves extracting blood from a patient with the belief that it will improve or cure their health. It was practiced throughout history, including ancient Egypt, Greece and Rome, China, India, and even 19th century France. However, its peak popularity occurred during the Middle Ages, when it was widely used to treat a variety of illnesses. During the Middle Ages, bloodletting was based on the belief that the human body contained four humors: blood, phlegm, black, and yellow bile. These four fluids had to be kept in balance in order for a person to be in good health. An imbalance was thought to cause illness, so treatments like bloodletting were used to restore the balance. Bloodletting was thought to be particularly useful in treating illnesses that were considered hot and humid, such as fevers, inflammation, smallpox, and even mental disorders. In the Middle Ages, bloodletting was usually carried out using leeches or lancets were small knives that were used to make incisions in the skin, while leeches were placed on the body to suck the blood out. The process of bloodletting could be quite painful, but patients were often given wine or other drugs to help them relax. Now that we know what bloodletting is and how it was performed, let us take a closer look at some of the ways that it was used to treat different conditions during the Middle Ages. For example, one common use of bloodletting was to treat fevers. The idea behind this was that by removing some of the hot and humid blood from the body, the fever would break and the patient would recover more quickly. Similarly, bloodletting was also used to treat inflammation, because it was believed that reducing the amount of blood in the body would reduce the swelling and pain caused by inflammation. Another use of bloodletting was to treat smallpox. Smallpox was a deadly disease that caused fever, weakness, rash, and sometimes blindness. During the Middle Ages, there was no cure for smallpox, but bloodletting was used as a treatment in an attempt to reduce the severity of the symptoms. However, there is little evidence that bloodletting actually helped people with smallpox. In fact, it may have even made the disease worse in some cases. Despite this, it continued to be used for centuries. Another illness that was treated with bloodletting was mental illness. During the Middle Ages, mental illness was often seen as a punishment from God. As a result, people with mental illness were often treated very badly. Bloodletting was used as a form of treatment for mental illness, because it was believed that by balancing the humors in the body, the mind would also be balanced. However, again, there is little evidence that this actually worked. Now let's talk about the equipment used for blood. There were two main tools used for this procedure: leeches and lancet. Leeches are small, segmented worms that have been used as a form of medicine for centuries. They have special suckers that they use to attach to the skin, and then they secrete a substance that helps to thin the blood and make it easier to draw out. Leeches were often used to treat a variety of different conditions, including headaches, fevers, and even arthritis. However, it is important to note that the use of leeches as a medical treatment is now considered outdated, and they are no longer used in modern medicine. Lancets, on the other hand, were small, sharp knives that were used to make incisions in the skin. This allowed for the blood to be drawn directly from the veins or arteries. Lancets were often used to treat conditions such as inflammation or gout. Overall, both leeches and lancets were used for a variety of different purposes during the Middle Ages and were considered to be effective treatments for a variety of different illnesses. Now let's see how bloodletting was done. The first step was to find a vein or artery to use for the procedure. This was usually done by feeling for a pulse, as this indicated that there was blood flowing through the vessel. Once a suitable vein or artery had been located, the skin was then cut open using a sharp knife or blade. This would allow access to the blood inside the body. In some cases, leeches would also be applied to the area in order to help draw the blood out. The amount of blood that was removed during a bloodletting session could vary depending on the condition being treated. However, it was not uncommon for several pints of blood to be removed from a patient during a single treatment. After the desired amount of blood had been removed, the incisions were then closed using a bandage or other dressing. Patients were often advised to rest afterwards and to avoid strenuous activity for several days. While bloodletting was generally considered to be a safe procedure when performed correctly, there were risks involved as with any medical treatment. If the incision was made too deep, it could lead to excessive bleeding. Additionally, if the bloodletting was done incorrectly, it could lead to infection. There were also risks associated with the use of leeches. If the leeches were not applied properly, they could cause irritation or even damage to the skin. As we've already mentioned, bloodletting was used to treat a variety of different conditions during the Middle Ages. One of the most common conditions treated with this method was the plague. The plague was a devastating pandemic that swept through Europe in the 14th century and killed millions of people. During the Middle Ages, it was believed that the plague was caused by an imbalance of the humors in the body, and bloodletting was used as a treatment in an attempt to restore the balance. However, there is little evidence that bloodletting was effective in treating the plague, and it may have even made the disease worse in some cases. Despite the risks involved, bloodletting continued to be used throughout Europe until the 19th century. It wasn't until the advent of modern medicine that the practice finally began to decline. Even then, it continued to be used in some parts of the world long after it was abandoned in Europe. There are many reasons why bloodletting was used for so long. One reason was that it was based on a well-established theory of how the body works. The theory of the four humors was developed by ancient Greek physicians, and it was widely accepted in Europe for many centuries. Another reason was that bloodletting was seen as a quick and easy way to treat a variety of different conditions. This was appealing to both patients and practitioners, because it avoided more difficult and sometimes painful treatments. Finally, bloodletting was often recommended by respected figures in the medical community. This gave the practice legitimacy and encouraged people to continue using it. The legacy of bloodletting can still be seen today in the language we use. For example, the word bleeding is still used to describe someone who is hurt or upset. The word lobotomy, which is the surgical removal of blood from the body, is still used in medical contexts. Bloodletting may seem like a barbaric practice today, but it was once widely used and accepted. It is important to remember that it was not done with malicious intent, but rather because it was seen as a way to help people. In conclusion, bloodletting was a common practice during the Middle Ages, but it is no longer used today due to the advent of modern medicine. While it may seem like a barbaric and terrifying practice today, it is important to remember that it was done with the best intentions. By understanding the history of bloodletting, we can better appreciate the progress that has been made in the field of medicine. Thank you for watching. If you enjoyed the video, please hit the like button and subscribe. Don't forget to share with your friends. We'll see you next time.